All right, welcome everyone. I am so happy to share this information with all of you today because I am so passionate about dementia care and making sure that families get the right support at the right time of their journey because it's a long journey caring for somebody affected by dementia, different stages, different changes. And so this talk is mainly for those in early to moderate stages. Know that there are more advanced challenges that you may be experiencing. Keep in mind, this is high level, but we're always happy to speak with you. You're welcome to sign up for a free 20-minute consultation where we can listen to your story and provide you with personalized solutions. So that brings me to today's topic is about dementia tips that families need to know. And this is what I've noticed in my 30 years in this industry working with older adults, especially working with those affected by dementia. So my name is Karen Tyrell, and I am the CEO and founder of my company, which is called Personalized Dementia Solutions Incorporated. I started my company when I first moved to BC in 2009. However, I've been working in long-term care and I was an executive director for an Alzheimer's society in Ontario before moving to BC. So, oh, I forgot I had this slide a little bit about myself. So here it is. Know that I also was on the design team for the very first Dementia Village in Canada, which is in Langley, BC. And a co-creator of the Adult Cognitive Wellness Center, which is a private adult day program in different locations in the lower mainland of BC. And I'm also the author of the book, Cracking the Dementia Code, Creative Ways That We Can Cope When Caring for Somebody Who Has Changes in Their Behaviors. So that's my specialty, is around supporting with behaviors. Oh, there we go. So today's presentation, we're going to talk about a quick overview, reminder about dementia. I do want to share a little bit about delirium because it comes up so many times when working with families, and we'll talk about Alzheimer's disease. But I want to talk about the common change to behaviors that you typically will see, and I'll share 5 tips that I think you need to know for the entire journey to help you get through some of those behaviors. And we will talk about a few of the top level communication tips that are necessary for families to start practicing if they're not already. And my top 3 survival tips so that you can get through this journey with the minimal amount of scarring is what I tend to say to families because we want you safe. We don't want you hurt. And then we'll end with some final reminders and we'll open it up for questions. So let's start with what is dementia. It's still very confusing out there for many people. Often I'll ask the question, is dementia a disease? Just to see what people have to say on that one. And there's times I'm in a crowd and I watch the room and I see people yes, I see people no, and then I see people don't look at me because they're not quite sure. So what I want to share with you today is that dementia is not a disease. Dementia is known as a syndrome. Now, what I'm going to share with you is an article that I found because I've been finding many over the years where I feel the media, for example, is confusing the public because their headline here, which was back in March 2023, but we still see these types of headlines. The article says dementia is a devastating disease, and that's incorrect. And with no cure for dementia, again, that's incorrect, depending on the type of dementia. So the real word should be Alzheimer's is a devastating disease, and with no cure for Alzheimer's. That's really what this headline should be. So we're confused. And plus, the entire world is confused because all of the different Alzheimer's societies around the world have a different definition. So I'm going to share with you the definition by the World Health Organization that dementia is a syndrome. And just so I'll explain a syndrome, it's basically a group of symptoms that come together. And when these symptoms are happening, from an individual we're noticing on a regular basis, then a person is affected by that syndrome. When I had a cold recently at Christmas time, A cold is a syndrome because, what a cold looks like, sore throat, runny nose, coughing, headache, all these fun things. And then I realized, oh, great, I caught a cold. Perfect timing, right on Christmas, the day before Christmas. And so it's a syndrome. It's a group of symptoms. So dementia is a syndrome that can be caused by a number of diseases, which over time destroy nerve cells and damage the brain, typically leading to deterioration in cognitive function. For example, the ability to process thought. Beyond what might be expected from the usual consequences of biological aging. Basically, dementia is not supposed to be part of normal aging. Here are the common symptoms that we would likely see in an individual diagnosed with a type of dementia. Poor memory. We all know this. The short-term memory, they can't remember what we said an hour ago. They can't remember what we did last week or even 5 minutes ago for some people. Thinking impairment, it's hard for them to think through processes, thinking through the steps in how to make dinner, thinking, process of how to get into my email. And, there's all kinds of examples of thinking problems. It's problem solving, basically. Judgment problems. Well, this is where a person might be choosing to do things that are unsafe or giving money to a scammer because they don't understand. That's poor judgment, that they don't understand the situation. But they're being, unfortunately with scammers and fraud, that's very complicated. But we need to understand that there's all kinds of judgment issues that can appear. Not thinking through that this could be unsafe, as well as judgment problems with saying things that are a little bit rude or inappropriate in a public setting. Those are just a few examples. Communication problems. Getting their information across, their feelings across, trying to comprehend what you're telling them to do. That could be compromised. They're looking at you like they don't understand what you're saying. And so some families talk louder, but it's not necessarily a hearing issue. It's a cognitive issue inside with comprehending the scenario, as well as getting the words out, the tip of the tongue type of situation of not being able to figure out the right word. But it goes beyond that to the part where an individual may not know what this is called. And, the thingy. They may know what it's for, but they may not know what the title of the object is. And that's not part of normal aging. And then there's personality changes. This is where the person, before we started this presentation, was saying that the person that they are caring for has changed. They're a little bit more aggressive with their personality, as opposed to some people who become more docile later on with their type of dementia. We never know what's going to happen, but certainly the person is not the same, and it's very hard on families to watch this happen. They used to be so happy to see people when they would come visit, and now, why are you here? I don't need you. It's really hard to see. So when we see these symptoms, all these symptoms happening to an individual on a regular basis. Now, there's different types of Alzheimer's societies around the world will have a few more of the common symptoms, but these are just the core ones I wanted to share today. That when we start to see these things happening to a person on a regular basis, this is where we should go and have this looked into. Have a clinician, a specialist look into the next question. And that question is, what is causing the dementia for this person? What is causing these symptoms? And here is a list of things that can cause those common symptoms and are found in each of these conditions or diseases. So on this list, a person could be depressed and have sadness, and they're not interested in continuing to live their life, and they're feeling no purpose. But unfortunately, the symptoms of dementia can show up if depression is not treated over time. And that's that poor memory, poor thinking, poor judgment, communication problems, and personality changes. Those symptoms can also be found in a thyroid condition big time we see many older adults with a vitamin B12 deficiency that might be mistaken for Alzheimer's. And there's families that say, oh, grandma is having poor memory. She must be having old-timers disease. Those types of things are being said, but unfortunately, it may be related to a vitamin B12 deficiency that can be treated. We just have to bring that level up. And some people need monthly B12 shots to help them. And then those symptoms of dementia can go away. So I won't have time to go through all of these here today, but I do want to just go over what is Alzheimer's disease. I'll do that next. But it's important to figure out what type of dementia we're dealing with, because there's different ways of treating somebody with Lewy body compared to vascular dementia, and compared to Parkinson's disease. So in my opinion, it's helpful to find out what's causing the person to have the symptoms of dementia. And that way we can move forward and also learn all the techniques that go along with that type of condition that we can support the individual better. So, I wanted to just remind us about the word delirium, because delirium happens way more than we think. It happens especially when a person is not well. And it brings on those symptoms of dementia all of a sudden. So the person was having good judgment and good memory, but today they're not acting themselves and their judgment is way off and they're doing strange things. Just because they're older, we don't want to say they're developing dementia and it's a progressive, type of Alzheimer's disease. But instead, to open up our eyes, could we be dealing with delirium when it's a sudden change? It's known as a medical emergency. So just wanting people to understand, when we see changes in a person, it might be due to delirium. And what causes delirium is pain, infections, UTIs, urinary tract infections, bladder infections, respiratory infections. That's a type of infection that can bring on delirium. Delirium is treatable, such as dehydration. We don't realize the person's not drinking as much as they used to. So giving them hydration, pain management, antibiotics for infections. Maybe their medications are being mixed up and they're not taking them correctly. That's causing their delirium. Anybody with alcohol and drug intoxication can show delirium. But there's also things like medical conditions, as well as metabolic imbalances, so such as low sodium, low calcium, low potassium. There's been cases where we had to check out, why is this person acting very strange? They did a urine test and it's fine, but they did a blood test and the potassium levels were extremely low. That was the reason for her sudden changes that looked like dementia, but it wasn't. It was delirium that was treated. And now every time we see strange behaviors in this lady, the family and the team at the retirement home would give her a banana instead of kicking her out and saying, you don't belong here, you need long-term care. So just wanted to make sure people understood this. Delirium shows up no matter where on the journey. So even if it's slow Alzheimer's and it's later stages, if there's a drop, please consider the drop in their abilities might be due to a delirium that needs medical attention. So continue to keep your eyes open for delirium, no matter where on the journey. But Alzheimer's disease is the most common type of dementia. Just want people to be aware of this. And I won't go into too much details, but this is what the normal brain looks like. This is Alzheimer's disease with the abundance and buildup of plaque. This is the amyloid plaques. And inside the neurons are the neurofibrillary tangles. And these are the two culprits well known for slowly killing the brain cells in the brain and shrinking it and causing the person to slowly change over time, because Alzheimer's disease is such a slow journey and it could go up to 20 plus years for people. It starts even before we notice changes. Unfortunately, there's no cure at this time. But it is one of the most common types of dementia around is Alzheimer's. So quick stats here in Canada. So as of just last month, the new statistics came out, and now we're over 700,000 Canadians are currently living with a type of dementia. That number will jump in just 5 years to go to 1 million. There's 414 cases every day in Canada. It used to be, I used to say around 300 every day last year when the stats in 2024. And then 20,000 plus Canadians will develop dementia every month when we hit the 2040s because of this baby boomer population that is aging. And many now are over the age of 65, and it's just going to continue for many years. We are going to see more cases. And so it worries me. I really want the world, the population to be educated about dementia, educated about how we can reduce our risks at any age. We do talks on that as well. But also to learn how do we best support people and how can we advocate for the families that are going down this journey and individuals. So, and then around the world, it's a problem everywhere. I won't go through all the details, but I don't want to bring sadness. I really want to bring empowerment because it's not easy to care for somebody on a regular basis. There's people who are caring for somebody in their household. There are people who are caring for somebody in a different household. They're watching their friends go down this journey, their neighbors. But knowledge is power. And hopefully with what I'm going to share next, you will feel that power so that you can make a difference. So let's just be reminded of what are some of the common changes that we'll see in someone's behaviors. We talked about the symptoms we'll see, but there's also behavior changes, not just poor memory, but there's behaviors. So the behavior, though, when there is poor memory, the person will ask the same question over and over and over and over for some families. It's really hard to watch that happen. I spoke a little bit earlier about the condition known as anosognosia to those who are waiting on the call. It looks like denial. I don't need help. Nobody needs to come into my home. I can do it all myself. I can clean, I can cook, I can do my own laundry. But as families will discover, no, they're not doing these things. They're having great difficulty. It's not happening. They're not eating properly. But they refuse the help or they refuse any kind of care, and it's related to the condition anosognosia. We have lots of strategies for that, so please feel free to reach out if you are dealing with somebody who's affected by anosognosia on top of their dementia. Increased anxieties. When am I going? Who's coming? What time is this? When's my doctor's appointment next? How much do I have to pay for this? And is it paid yet? These are some examples of high anxiety that can happen for individuals. And then the families have to deal with this over and over, explaining, no, the bill's been paid. It's fine. The appointment's next Friday. And they're trying to reassure, but that anxiety is creeping up. Some people start to show increased agitation for things, even minor little things, like something fell on the floor. And they get really mad and agitated. Why did you do that? Whoa, relax. Families would tell me, they're trying to tell them to calm down, relax. But that agitation can happen because of the changes in the brain. Unfortunately, if that agitation continues and is not addressed, it can turn into aggression, whether it's verbal or physical. Wandering is very common as well. People pacing or leaving and going down the street thinking they're going to the grocery store, but they get lost. There's all kinds of different wandering. There's goal-directed or there's just random wandering for some people. There's strategies on how to keep people safe for that. Paranoia and misperceptions. I spoke with a new client yesterday telling me about her client, that she's a home care person, and her new client, she doesn't know how to handle because she's asking the client, like, who's coming into my house? Why are people moving my things? And she didn't know how to handle this. So paranoia is very common, as well as misperceptions. Things like, you're supposed to pay my bill for me, or misperceptions that the doctor said I'm going to get free prescriptions for a year. when it doesn't even make sense. It's never been said. There's all kinds of examples. So these are just a few of the common changed behaviors that you may notice when you're supporting somebody. Everyone's going to be different, but I always want families to take a moment, think about what it might be like for them. What do you think's going on in their brain if they're losing brain cells? The brain wiring is changing. They don't understand. They don't remember. They don't think they have this problem. They don't know where they're going. And it's hard for them as well. My wish is that I can make harmony for everyone and in their family, because it's a difficult journey. So how can I bring about harmony? I'm not there with you, but I can give you these ideas. So I want to share with you my 5 dementia tips that I think you should know in order to help you stay successful. And so here we go. So if we can take a deep breath, I will share the top 5 with you, starting with, now don't shoot the messenger, but our goal is to try to always keep the peace with this person. Now, everyone's situation is different. Some people have always had challenging relationships where they're not happy with one another. I told you, no, you didn't. Yes, I did. No, you didn't. People trying to win and be right. And that's not easy in dementia care because the person doesn't remember. And even if you're trying to be right, then that makes the person feel stupid or they're not able to keep up or understand things, and it doesn't help their self-esteem. So if we can look at this in a way where, okay, their brain is changing, and sometimes it helps to maybe imagine what's going on in their brain. Imagine the brain cells are not the way they used to, because we can't see it. I can't look in somebody's brain and go, oh, I see their problem right there. But if I had a finger missing or a hand that wasn't working, then you would say, oh, well, obviously she can't open that jar by herself. She needs help. And so you might want to help me because you can see I'm going to need help visually. But in the case of changes in the brain, cognitive impairment, we can't see in the brain. So it's going to be hard because we might be saying things, and I hear this a lot from families, oh, they're doing it on purpose just to make me mad. But unfortunately, families do come to realize, well, it's not on purpose. They just can't figure this out. They just can't remember. They can't understand. So all we can do to keep the peace is trying to engage as positively as we can, rather than, no, I didn't, or you're wrong, or that's not what I said, in a negative tone, in a negative way. Then what happens right away is that individual has now got their back up, and now they're going to want to bark back. And so the barking and the challenges start to happen. And that's when gloves can come on, and they want to get into more of an aggressive type of situation if they're not feeling in a peaceful setting. And again, there's people who lash out, not realizing that that's poor judgment. We shouldn't be lashing out like this. We can talk it out. But the rationale, the reasoning, all these skills are not working as they used to. So how can we engage more positively? Well, I really encourage people to validate the person's feelings. Give yourself a moment to figure out, okay, what are they feeling? Right now, they just barked at me. They started the situation. They yelled at me. Why did you move my object? I don't know, whatever the object is. And you want to say, no, I didn't. Sometimes if we just stop ourselves and go, oh, okay, let's just pretend it's a mom. Mom, I see that you're very upset about this situation happening. That shows you're validating their feelings. You're calling it out. And for me, I like to just make sure the person knows that I noticed how they're feeling. If they're frustrated, I might say, wow, you look frustrated. If I see that they're, worried, I can tell that you're worried. It's basically one sentence. Just call it out, validate their feelings. Whatever you notice, just call it out. I notice this that you're going through. When we validate another person's feelings, it does help to go, oh, good, like they notice me and they're not fighting me. So it's starting to keep the peace. Whereas a lot of people, I've seen professionals and families, don't be mad, don't be worried. There's nothing to be worried about. And those types of sentences are not validating. And they're basically telling you to don't feel a certain way. And it's the opposite. So an idea is to learn the technique of validating somebody's feelings, just to show you're on their side. I also like it when we show that we're on their team and we're not fighting them. And any way you can do that, basically showing you care, show I care about you, or say I'm sorry. And I know some people don't believe, oh, I didn't do anything wrong. Why should I say I'm sorry? But I'll tell you, it is magical. Especially Canadians know this. Like when we say sorry all the time, it does bring a peace, right, for the situation. And I've been told many times I always said sorry, and there was no reason for me to even say the words I'm sorry. But I've learned through psychology that there are professionals who use this as a technique in their counseling sessions, is where they have the person visualize the person that hurt them years ago, who may no longer be living. They have to imagine that person saying sorry, and it does something to us. So even if you talk to another person, you go, oh, I'm so sorry that happened to you. I'm so sorry you're going through this. I'm so sorry you can't find your remote control right now. Whatever it might be, or I'm sorry to see you're having troubles with the remote control. When we just tuck in those words, I'm sorry, sometimes it just brings a feeling of peace for that other person. So for me, I like to also say we have to do whatever works. So we're going to try to engage as positively as we can, validate feelings to keep the peace, say I'm sorry if we have to. And also in dementia care, in order to keep the peace, I trademarked it, but I call it therapeutic reasoning, because I've noticed we can't reason with people who have poor memory, poor thinking, and poor judgment. It's hard to get them to understand the situation. As example, if somebody's if they believe somebody's stealing from them, but they're the ones moving things, which is very, very common, and they're hiding things. I may say things like, oh, wow, I sorry this happened. I can see this. It's because you're so worried. Well, how about I look into it for you? So basically, if you didn't notice, I'm crossing my fingers and putting it behind my back, because I may never look into it, because I know they're the one doing this, but it helps that person to feel better. I'm reasoning with them by saying, let me look into it. Is it okay if I look into it for you? That is an example of therapeutic reasoning. Therapeutic reasoning can go as far to another extent as if they're worried about a family member, like their mom and dad, who passed away many years ago, and where did my mom go? She was just here. We can use in dementia care therapeutic reasoning to say, oh, where do you think your mom went to? Oh, to the store to get groceries? Okay, you're probably right. She went to the store to get groceries. So this is an example of therapeutic reasoning, and in your case, I don't know, but some cases, families are going to have to learn the technique of using therapeutic reasoning in order to keep the peace. Because if we're just trying to reason with them, well, your mom is not here. She's not here. She died many years ago. Well, no one told me. How come this happened? I'm crying now. Like the person might be crying because they think their mom just died and no one told them. So why are we putting them through this stress? Let's keep the peace. Mom's probably at the grocery store. And so these are just some ideas of how to keep the peace. Now, but therapeutic reasoning, I just wanted to give a little bit more information. It's reasoning that's logical to the person. If they believe it to be true, all right, let's let them have it. If they didn't believe that you already went to the doctor's appointment, all right, we'll make another phone call or another appointment. But maybe we won't make another appointment. Maybe they'll forget, but at least we didn't fight them saying we did go. No, we didn't. Yes, we did. No, we didn't. Okay, I'll just make another appointment. And so all of this is going to provide a benefit to them to you, to anybody else in the room or in the home. We're providing that reassurance and giving that peace. Reassurance, I believe a lot of people with dementia are not getting enough of. So we want to give as much reassurance as possible. And so with therapeutic reasoning, you can agree with them. We don't want to correct. We don't want to cause any friction. Tell them you're going to look into it. I love that line. You might want to try to remember that. Okay, how about I look into it? And let's see what they say. If they agree, they're going to have that reassurance, and then we move on. Some cases we have to say the concerns have been solved. In the case of my book, I talk about Clarence, who had to milk the cows. He believed he was back in time and he was still living on the farm, so we told him that the cows have already been milked today. Therapeutic reasoning. We want to keep the peace. So would you rather be right? Clarence, you don't have the farm anymore, you sold it. Or do you want peace? So everyone's going to be different. Use it wisely. Don't use it on anybody without dementia, not even your husbands, okay? Like I tried. No. It's only for those who have trouble coming to our reality. And we want to give them that reassurance to keep the peace. Okay, so you're welcome to give it a try. Put it in your back pocket, just in case you might need it. Dementia tip number 2, we're going to have to be in their reality. We can't force them to come to our reality. And I talk about the memory onion, where people go backwards in time and they start to relive that area of their memory, that era of time when they were in their 20s or maybe their 50s. We don't know. They may go backwards. And then again, maybe they're looking for their mom and dad at age 10, that sort of thing. So we're going to have to go with them. We try to bring them out to our reality, the outer layer of what we just have been doing, but we do it gently. Oh, I thought we were living at this house. No. If they say, I live at this house where I lived before, okay, we agree with them. We don't want to fight. We go, okay, well, let me look into it. We may want to use some therapeutic reasoning, but we want to stay in their reality so we don't cause friction. It's hard to do for a lot of people, but give it a try and you'll see a difference if we go into their reality. Tip number 3, I want you to become the master of distraction. So master that art. So basically we're redirecting them after we calm them down. So after we said, oh yeah, the cows have already been milked. Now, Clarence, come with me. Let's go do whatever it may be that he loves. So a redirection technique, a deflection, we really want to deflect to a new topic or change the topic completely, change of scenery, get them out of that room that they were just in because there's maybe a trigger happening in that room, whether it's the television, whether it's a clock on the wall, whether it's the type of sofa or book on the shelf, like whatever it might be. We might have to change the scenery, get them out for a walk, so that concern they were having, that we were almost about to have argument over, we calmed them down, we kept the peace, we stayed in their reality. Now let's go and distract the situation in order to keep the peace and to keep that going. So I've had a lot of families who will say, I've calmed them down, it was great, but I tried to distract them. I calmed them down and then I walked away. And then they realize the situation just loops and loops and loops. If they're still sitting in that chair and they're still talking about it, it's because we didn't master that art of really getting them out of one part of the brain into another part of the brain. So it's really trying to, so for example, left brains to right brains. Right brains is all about our creative side, music, art. Let's move them out of a worry part of their zone to starting to sing and dance together. That might be a perfect way to distract the person if that's what they love, especially putting on the music they love. If it's Elvis Presley, get it on, have it ready to go all the time to play for your opportunity to now, after you've calmed them, to distract. So that's very important to use as often as you think necessary. And hopefully that will change the mood for your home. Tip number 4, it's reminding us all to focus on what they can do. not focusing on what they can't do anymore. So maybe they can't make the meal, but they can still help out with washing dishes. Maybe they don't do a good job washing dishes, but maybe they can help unload the dishwasher as opposed to loading the dishwasher. Like sometimes we just might want to tailor things a little bit. Maybe it's not the 500-piece puzzle that they used to love. Now we might be down to a 20-piece puzzle. So it's just trying to focus on that and not give up on the person like they have no skills, no abilities, because the person still wants to feel needed. They still want to contribute. They still want to do the things they love. But if we're not adapting and of the activities for them and focusing on the positives rather than the glass half empty, that, oh, they've got dementia, they can't do anything, then it's not going to be smooth and positive for either of us as caregiver or the individual with dementia. All of us need purpose. We all love to have some kind of purpose. So how can we incorporate purpose for this individual who has cognitive changes? So let's focus on what they can do. And maybe we glorify that, like, oh, you're so good at the recycling, or you're so good at shredding important papers. Wink, wink. Maybe it's not important papers anymore, but it's papers and they're shredding. Those types of things that they're really good at when they're having a bad day. That could be the distraction, is focusing on what they can do so that they feel good about themselves. And when they're feeling good about themselves, maybe you'll notice the mood and the harmony will appear in your home. But it can be hard on the caregivers because it's sad watching the person we once knew change so much. But this is a tip to remind us to focus on that, what they can do, to see if we can bring back some purpose for that individual. And the last tip I want to share is reminding all of us that we can't change anyone else. We can't change the person. We can't fix their brain to remember. We can't make them understand things that they can't understand anymore. We're never going to change them, but we're going to have to learn how to change us, how we respond, how we communicate, how we answer their questions. Instead of, "He told you the 15th time already," we may have to go, "Yep, we're going to have supper at 5:00. Yep, supper's at 5." As opposed to getting angry. And it's hard. It's hard to do that. Now I'm going to talk about strategies for you, but these are the tips that's going to help you to get through your journey. And again, a reminder, do you want to keep using your techniques that are not effective, or do you want peace? So, it's something just to think about. Like, okay, what can I change that can make a positive difference? Maybe I won't get upset anymore. Maybe I'll put their clothes out since I'm letting them be independent, but they're not putting their clothes on appropriately. So maybe I do need to put some of the clothes out to guide them, but let them do most of it. Or there's families the opposite. They do everything for the person. They're putting on their pants, putting on their socks, putting on their shoes. But you know what? Maybe the person can do some of it on their own. We don't have to be going to the extreme. And treating them like a child, because that's also lots of friction. They're treating me like a child. And so changing our ways and how we're communicating, because there are times when there's families have told me it's like taking care of a child, but we don't want to use the techniques on a child, but we want to use the right techniques for that individual to keep the peace. So we might have to change our ways. Verbal communication tips I just want to share in case we're not using them. Perhaps reminding ourselves that we might have to start slowing down our sentences and using simple words, simple sentences. Shorten it up, not long, no, sentences, because their brain is trying to comprehend and put it in, but after 5 sentences in a row, they're lost. So maybe short, simple sentences and slowing down your speech, especially if you have an accent, if you're, we notice this with some professional caregivers are speaking really quickly, which causes the person to get angry. Well, it's because they need to change their ways. They need to slow down their speech and say every word as opposed to saying every word. So we're just learning to make those little changes and maybe ask one question at a time and wait for a response. Some people are affected in the subcortical region of the brain, and therefore it takes a little bit longer for it to work through the whole processes before their answer comes out of the mouth. I learned this at a young age. I remember asking a gentleman with Parkinson's with a little bit of dementia symptoms that I said, "What would you like to do today?" "Maybe we should go here." "Oh, wait a minute. How about we go here instead?" And there was 3 questions in a row, and he looked over at me and his slow speech, he said, "Shut up." I was like, oh my gosh. I didn't realize I was getting excited and not giving him a chance to respond. So you learn from your mistakes, and I definitely learned that one. Asking simple yes or no. So again, instead of saying, "What do you want to eat?" and the person getting frustrated, "I don't know what to eat," because they don't comprehend what is available to eat, or "Where do you want to go?" Again, I don't know what I want to go, where I want to go to. But we might change it up to say, "Would you like chicken for supper?" and wait. Or "Would you like to go for a walk?" and wait. There's a scale almost where, earlier communication techniques need to be used for people in earlier stages, but then we may have to simplify even more when we get to a later stage. So it can be, "What would you like for supper?" and wait and see what they answer to give them choice and opportunities. But it may turn into, "Would you like chicken or fish for supper?" Or it may turn into later the simple yes or no. "Would you like chicken?" Or it may just be showing them the chicken and rubbing your belly. "I'm hungry?" Something like that, as things change in the brain. So it's learning to change our ways and always make sure we're using that pleasant tone of voice in everything we do, because at some point, the individual is just focusing on, are you a good person or a bad person? Because they don't fully comprehend the entire situation as things progress. And we don't know what's really happening in their communication center of their brain. But if you see here, there's 7% is only the words that they're listening to that's helping them to comprehend. 38% is your tone, and 55% is your body language. So we want to make sure we're giving positive body language at all times, because if we're doing negative stuff, that's not good, because they're going to think, "Whoa, that's bad. They're a bad person. They're saying no." So even when the answer should be no, I'll always go, "Okay, you want to fly to Edmonton tonight? Oh, great idea. But how about I look into it, because I heard there was lots of snow." And they may be canceled. There's ways to get around it, but starting with the positives and not, "No, we can't do that. We can't do that. It's ridiculous. Why would we do that tonight?" Because that tone of voice and that negative output can cause that person to get angry and may react to you in a negative way. Reminding us to also use a lot of that body language, the visual cues for things. Like, you may want to give them the object that you want them to pick up, as opposed to just saying, "Go grab the pen." You might have to point, you might have to show some gestures, you might need to even use notes to explain things with them. I worked with a lady yesterday who they learned from me to just put some notes for this woman to provide that added reassurance, because she needed to hear that, because the words alone were not always helping. She needed to see a visual, because of course people joke about one ear and out the other when there's poor memory. So having it written down might make a difference for your scenario. But again, a reminder that a lot of cues, even as we are moving into a stage where we may not have the ability, the individual may not have the ability to look at their plate and have the fork next to it, but they may not know to pick up the fork and start to dig and bring it to their mouth. So these steps may need extra cueing and to guide the person with that fork, and then they can do the rest on their own once they catch on to the process. And this is a condition known as apraxia. Also, again, reminder of lots of facial expressions because they're watching you, they're looking. And so if you're like, they may go, I don't know what they're talking about, but I'm not happy. And I tested this on a family once. I said, your mom's not paying attention to any of your words. Her communication center is so mixed up. She's just watching your body language and listening to your tone. And I did this little thing with her where I said, I won the lottery. I won lots and lots of money. And the woman, what did you think she did? She goes, oh dear, I'm so sorry. Because that's what she was watching for. So it's a reminder to all of us, if you're noticing that the person's really not paying attention, then why do we have to talk about negative? Let's just keep the mood positive and keep it a pleasant environment. But a reminder for all of us, as family caregivers, as friend caregivers, dementia care is not easy, but it's reminding us to always try to have patience. Patience with not only the person that we're supporting, but with ourselves. Because some people are thinking, I'm doing great. Maybe I validated for you, you're doing great. But there's some people that know they have some things they could work on. So be patient with yourself and remember, we all make mistakes. There's been families who come to me later, go, oh, Karen, I remember you told me not to do this. And what did I do? I did that. And, it's like, okay, don't be upset with yourself. We're going to make mistakes, but keep practicing. As long as you're aware, knowledge will help you. The knowledge is power. Just keep practicing. But I just want to quickly wrap up with my top 3 survival tips. All these tips are important, but these are my top 3 for you. And remember to take your breaks. We cannot give care to somebody 24/7. It's not humanly possible. We need time for us. I think of a big pie, and how much of the piece of pie are you going to give to each person in your life? How much are you going to give to your husband, your spouse, your friends, your neighbors, your family? But how much for you? You need a slice. Remember that. If you're only giving yourself a tiny sliver, it's not healthy. You deserve a good piece. Some people are going wider for themselves, and that's your choice. But I just don't want you to be one of those people who doesn't give themselves any piece of the pie. And that pie is basically breaks. Take breaks. Take out time for you. No caregiving, no thoughts of caregiving. Go and get lost in a book or a movie or conversation with friends over coffee or dinner, walks, swimming, I don't care, dancing. Do what you can to give yourself that break. If you don't, you won't survive. Talking it out. I really believe this, and I've seen it firsthand. All the support groups I've been facilitating for the last 15 years, I see the value of people talking it out. So be sure you're doing that, whether it's in a support group or whether it's with people at a church that you belong to, group of friends, or a counselor, or somebody like me and my company as a dementia consultant. Please talk things out. You learn from what you're going through by your own words when you talk it out. I'm hearing weird noises, but I'll keep going. So be sure you're talking it out. And then the third one, never stop learning. There's so much more to learn. Knowledge is power. So continue to promise yourself you'll continue to learn the strategies, the techniques for each stage, each challenge. When it's time to move into a care home, what should we be doing? Those types of things. So keep learning, never stop learning. So quick reminders for you as caregivers. Please reach out when you are realizing, gosh, I'm not coping well. I'm not talking things out. I'm not getting my breaks, or, I'm not handling this well. I don't know the techniques. Please reach out. Have realistic expectations, because that will help you. I know there's a lot of families really disappointed with the government services available, and they have their high expectations, but understand that we want to keep realistic expectations for whatever service you're getting, whatever support you're getting. realistic expectations for yourself, for other family members. Let's not expect them to be doing all the activities. It's really important in this entire journey to have realistic expectations. If you don't know if you're at that location of being realistic, talk it out, talk to others, learn. Set boundaries, put that line in the sand, because it's going to be so helpful when you say, from now on, I'm going to do this, but if we get to the point where now they're incontinent, or they're not sleeping at night, or they don't remember me, or they're no longer able to go to a day program, I'm going to then get support to move on to other forms of care, like whatever it may be for you. Set that boundary. Please stick with it. There's that radio commercial, know your limit and stay within it. Caregiving, we can get pushed and pushed and pushed and pushed because we feel a lot of emotions, a lot of guilt. But we want you to have the realistic expectations, set those boundaries to take care of you. On this journey, please don't ignore your own healthcare needs. I've seen it. Burnout is very real. And people get sick as caregivers because they're ignoring their own needs. Somebody had a sore toe and they didn't go, turned into a massive infection. She almost had her toe amputated. So I've seen people with high blood pressure and they're not going to their doctors to get medications, and they almost had a stroke, a major stroke. So be careful, watch your own needs. Try to stay positive, have gratitude, because not every situation is all terrible. Look for the silver lining, look for the positives, look for the light. There's been families who've told me, wow, you know what? I never used to be the driver in the family, and now I drove my husband to an appointment in downtown Vancouver. I'm so proud of myself. I really stepped out of my comfort zone and I did something I've always wanted to do. I was always so nervous, but I made it. I did the trip to Vancouver. So if that's you, find those positives that are making you stand out and be strong. And then, again, maybe a gratitude list every night, 3 things you're grateful for in your world. And reminder to always keep your sense of humor. Laughter is a medicine. I love this cute little picture. I love cat and dog videos and things like that. It makes me feel good. So, when I have a bad day, I'll go look at these videos on YouTube, and I just love, nope, haven't seen the cat. I just love the dog's eyes. So please look for the sense of humor in your world. Not everything's going to be perfect. There's going to be things that we're not going to be able to have humor on, but there might be a few things. And so look for that and keep that sense of humor going. Just to wrap things up, we at Dementia Solutions are here to help families. We've been doing this for over 15 years as a corporation, and we just don't want to see families go through the challenges. We offer that free 20-minute consultation. We do have private consultations that you can book as needed, whenever, 6 months from now, a year from now. We don't want you to suffer if you don't feel like you have supports to turn to. We do have a free monthly Zoom support group that you can join and learn from other families. We can pass that information on to you. It's also found on our website. It's on the second Thursday of each month in Pacific time zone at 7 p.m. But we have more support options across Canada with our new family support membership. And I'll explain a little bit. We are providing more services for families in a unique way. But of course, I love doing education. This is another part of what I do for professionals, for staff, workshops, and any kind of public event. Just different topics like, is it old age or is it dementia? How to maintain a healthy brain, navigating the dementia journey. We have many, many topics that we help with. You can stay connected with us through our newsletter, where we put on events, and we'll share it with our newsletter folks, and you can join anytime like we did for this one. So our family support membership, just want you to know this is a toolkit where we want to empower you with that knowledge, with guidance and resources. It's forever there for you when you're a member. You can go in anytime and watch videos, watch stories. We've interviewed families. You can just check out the interview that we've done with them and learn with how they handled their journey. Lots of resources that you can look at, checklists. Oh, there's so much. Every Wednesday, we do a weekly Q&A call for our members. We have support groups. We have other sessions in our membership site. Just so you know, we had a family day. This is why we're doing this, because Family Day was this week. We wanted to give a special offer for families on the journey. If you want to become a member, there is an enrollment fee, because some people will come in, look at all the materials, and then they leave. And so we had to have an enrollment fee a little higher for people to get all that juicy material. They can watch it all, but they can cancel their membership anytime. So they'll have it for the month and then they can cancel. So there's a little bit of an enrollment fee, but after that, every month it's only $15, and you get access to me and all the knowledge, and we add more every month. So it's an exclusive membership for enhancing your dementia knowledge, getting the support from our other support groups. It's all included for free when you're a member, but right now it's 75% off the enrollment fee. Normal enrollment fee is $97 for the entire ability to view everything on our website for the first month. You're going to see this when you come to the main page. You can access all the knowledge, videos, little clippets of we call knowledge nuggets, and downloads, quick tips and that sort of thing. The guidance, you'll find how to join the weekly and all the support groups to get firsthand information from us, resources, and the caregiver stories. We are donating net proceeds to the 𝐿, which is Canadians for Leading Edge Alzheimer research. So funds that we bring in from our initial membership fees are going to this organization to help us find a cure. So this is a little bit about our new family support membership. We also have my book. If you just want to learn, it can be from our website or Amazon, or try your local library. It might be in the library for you to read. We also have a coloring book. It's an engagement tool for when people visit somebody with more moderate stages of dementia. Find everything on our website. And before we wrap up, I just want to remind everybody one last time, my top 3 survival tips. Do you recall what they are? Number 1, take your breaks. Number 2, talk it out. And number 3, never stop learning. There's so much to learn. And we do have a handout for those that attended this talk. So that will be emailed to you after this session. We'll end it now with anybody who wants to share your thoughts, your situations, or your questions, because we want to see you thrive on this journey. You're welcome to stay in touch. As I mentioned, you can go to our website to sign up for our newsletter. We're on Facebook. We have a Facebook group as well. Instagram, LinkedIn, and X, used to be called Twitter. But again, dementiasolutions.ca.